Today I'm going to deal regarding pain and its management. Okay, it includes definition of pain, physiological process involved in pain, characteristics of pain, types of pain, pain scales, management of pain and all. Okay, first I discuss regarding definition of pain. Okay, pain is an unpleasant sensory and emotional experience that is associated with actual or potential tissue damage. Okay, unpleasant sensory pain means what? Okay, if the any accident is happened, okay, the person's having that tissue damage that cause the unpleasant sensory pain. Emotional experience means what? Emotional experience pain means, okay, if the person is detached from that loved ones, okay, at the time the person is experiencing emotional pain, or else the cancer patient having that emotional pain because of that altered self body image and all. Okay, that cause the emotional pain and all. Okay, understood. Okay, then next move on to that physiological process involved in pain. Okay, physiological process is divided four category. Okay, the first one is the transduction, transmission, perception, modulation. What do you mean by that? Transduction. Transduction means sensory nerve endings in the organ is convert stimuli into electrical signals. Okay, if the person is experiencing pain, okay, first it is like a stimuli. Okay, later it converted into electrical signals in the transduction stage. Okay, the second one is the transmission. Transmission means electrical signals are transmitted through the nerve fibers to that spinal cord, brain. Okay, that is modulated by neurotransmitters. Understood. Transduction means what? Stimuli is converted into electrical signal. In transmission, what will happen? Okay, electrical signals are transmitted through that nerve fiber to that spinal cord and all, through with the help of the neurotransmitter and all. Okay, then third step is the perception. Perception means what? The brain interprets the signals as a pain. Okay, resulting the person is experiencing of pain and all. Until that the person is not perceive that things means that pain means that, okay, that we is not feel that pain and all, especially in DM patient. Okay, what will happen? DM neuropathy happened. Okay, the nerve endings not function normally. At the time the person is not perceive that pain and all. Okay, the last step is the modulation. Pain perception is altered or suppression through the release of endogenous opioids. Okay, endogenous opioids means what? Exogenous means that outside we have to give the opioid drug. Okay, here endogenous is there. Okay, you have to give that opioid. Exogenous means I already told from the outside. Endogenous means in our body itself only having that opioid drug. Okay, that will be released. Okay, next we have to move on to that characteristics of pain. Okay, characteristics of pain. Okay, we have to divide it acute and chronic pain. Okay, based on that characteristics. Okay, based on the duration, underlying cause, treatment and examples. Okay, the first one is the acute pain. Acute pain is the short duration, chronic pain is a long duration. Okay, short duration means from the weeks to months. Okay, here months to year will be happen. Okay, underlying cause, the underlying cause of tissue damage here in case of nerve damage and all. Okay, treatment, pain medication, rest and physical therapy is there in acute pain. Here combination of medication. Combination of medication means what? You have to give PCT along with NSAIDs. Okay, non-steroid anti-inflammatory drugs and all. Okay, physical therapy you have to give, psychological therapy also we have to give. Examples, cartoons and sprain injury in the acute pain, neuropathic pain and lower back pain in that chronic pain. All of you understood regarding that one? Any doubts is there? Okay, next we have to move on to that types of pain. Okay, the first one is the somatic pain, visceral pain, neuropathic pain, cancer pain and idiopathic pain. Okay, what do you mean by somatic pain? Okay, somatic pain is originated from that skin, muscles or connective tissues and all. Okay, that is called as the somatic pain. Visceral pain means what? Visceral pain means the pain is originated from our internal organs. Okay, that is called as the visceral